Okay, well, in this second vignette, I'm going to address the issue of how did the issues of trust and mistrust play out in COVID management policies. Let me say something first of all about our project. In the project, we initially identified 6 countries, 3 in Asia, 3 in Europe, and the design insisted on the fact that back then, in 2021, when the bid was being prepared, these were the best, the average, and the worst performers in their respective areas. So we identified Singapore and Portugal as being, in a sense, good performers, Hong Kong and Greece as performing the second intermediate pair, and Bulgaria and Indonesia as being more problematical cases. I'm going to just take some examples from the European cases here, given the types of trust and transparency and their interplay. Firstly, trust in the country's government was deemed to be a general function of government. A government is supposed to engage in an authoritative allocation of values and resources. And in very broad brush terms, I think the early relationships did hold true. In Greece, there were high levels of trust in government to start with at the very beginning of the pandemic, and this correlated fairly well with conformity in terms of social behaviour. So 90% trusted health authorities in surveys, 85% declared that they trusted government leadership during the initial pandemic phase. In Bulgaria, however, the very other end of the spectrum, government was fundamentally distrusted, and scientific voices were somewhat overshadowed by political narratives or indeed by misinformation, which diluted their influence on public behaviour. Government, in short, was suspected of corruption. In Portugal, there were swift early containment measures, and this helped initial success and strength and trust in government. And Portugal achieved a very high vaccination rate, 74% by August 2021, above the EU average. But in each 3 of these cases, our initial cases, mistrust gained ground in each of the countries as the pandemic proved durable, and the various variants tested the nerve even of the most vaccinated populations. The most general finding is that institutions perform key roles in maintaining trust, not just political and administrative structures and their degree of transparency, but also the capacity of key health institutions in particular. And here we would identify the rather poor state of the National Health Service in Portugal, the over-centralised, hospital-driven structures in France, which is another country we looked at, the diversion of resources in Bulgaria, away from where they ought to have been spent, and indeed the lack of transparency in Greece. So it's not all a happy story. But the state of the health services, I think, was a primordial institutional variable. It also shaped the capacity that countries had to engage in intra- and inter-institutional learning. In other words, to learn from the pandemic. I must also mention trust in scientists. Trust in scientists was the weakest in the countries with the worst cases of COVID-19, Bulgaria. And again, a focus back on Bulgaria in particular. Bulgaria had one of the lowest vaccination rate in the EU. And this was largely due to mistrust, misinformation, and the prevalence of conspiracy beliefs. Trust in scientists was higher elsewhere, but it was significantly eroded in each of our test countries over the duration of the pandemic. Scientists, partly because scientists maintained close relations with government, but they were caught in the misfire of mistrust as the pandemic wore on. And where scientists disagreed with each other, and they did in public in various countries, the effect was rather negative in terms of steering public opinion. Think of France in particular. The critical question was in relation to vaccination. And except in that rather specific case of Bulgaria, the push to vaccinate, coordinated by scientists, saved many, many lives. And so the general conclusion was that public trust, being trust in medical experts, was an important component of the pandemic. And the countries with the best behaviour were actually those countries with the highest degree of trust in medical experts. Correspondingly, the countries with the lowest trust in the experts, Romania, Bulgaria, Hungary, Lithuania, scored the worst morbidity rates per million ratios. There's a more complex story concerning international actors, the World Health Organization, the international experts, even the European Union. And international experts were sometimes mistrusted a little bit by popular opinion, not least because they appeared rather removed from daily concerns, but also because they spoke in a language that was sometimes barely comprehensible. And the need for simplicity should be emphasized here. Now, what governments know as epistemic communities or knowledge communities were very important for governments, but there were sometimes doubts expressed. And particularly damaging was when government ministers themselves appeared to distance themselves from expert views in an early stage over whether it was useful to wear masks in particular. The fourth point is there's a link we noticed between trust and transparency. Governments went to great lengths to substantiate information about the progress of COVID. They published websites, engaged in daily press briefings, provided statistical information. And in some cases, they adopted a political message that was a highly effective communication strategy. So the Greek government, for example, highlighted popular values, the centrality of the family, and skillfully downplayed class dimensions of the pandemic's impact. And this significantly impacted the uptake of the vaccine. On the other hand, a 2023 study in Bulgaria found that misinformation and conspiracy theories were widespread in that country. And those believing in conspiracy theories were much more less likely to be vaccinated. The link with trust was close. Since governments were not trusted, their messages, if governments were not trusted, their messages were blurred or downright rejected. And again, this underlined the necessity of consistent messaging from governments. So just to say another word on this, across the 4 countries we're talking about here, trust in official health sources was important, and the more that people believed in official health sources, the less likely they were inclined to be to rely on friends or social media for that information. Fifth and final point, there appeared to be some linkage between interpersonal, social and collective forms of trust. So family networks mattered, local or regional influences mattered, as well as did the broader questions of trust in government. In terms of interpersonal relationships, for example, in each case we looked at, lockdowns created tensions. There was a rise in suicides, a higher incidence of divorces, for example. The family unit was called upon to perform major roles beyond that, which is reasonable, especially in the field of education, where families were having to school their children. Interpersonal relations and kinship relations made a big impact in some countries. In Greece, for example, where the extended family holds sway, older and more frail people were kept within the family, rather than being institutionalized in nursing homes. And this was a positive effect in the sense that they were less likely to catch COVID-19 in those institutions. There were also well-documented differences between specific localities, between specific regions in many countries. But there was also, on the counter side, we have to identify the belief or the suspicion of corruption in a number of cases. Were the funds that were supposed to be used to fight the pandemic actually used to that end? This was a big problem in a number of countries. Now, of course, we were emphasizing here the importance of trust and transparency, but it's important to say that, of course, these are not the only variables that we should be considering. Many other factors matter: the severity of a response, the mode of government, geographical location, previous experience with the SARS epidemic, societal values and culture. These are all heavy variables that help to influence how successfully the countries dealt with the pandemic. But taking all that into consideration, public trust is confirmed as an important factor here. A combination of high political trust in medical experts, together with a high level of transparency, could lead to higher levels of compliance with governmental directives and, by extension, lower levels of deaths from COVID. So learning, trust and transparency, and COVID-19 were all linked in some way. Mobilising trust, the final remark, to fight a pandemic requires consistent messaging from government along with authoritative steering from intermediaries such as the health and the medical professions, but also a broad buy-in from society itself. Society has to be mobilised and engaged in fighting a pandemic, and I think this is a lesson that will be left from our study for future generations.